So today we will begin a simple primary care review on paronychia. Paronychia is an inflammation involving the lateral and proximal nail folds. Acute paronychia is an acute inflammatory process with or without abscess formation for less than 6 weeks. Pathogens, this includes Staphylococcus aureus, Streptococcus pyogenes, Eikenella corridans, Fusobacterium, Peptostreptococcus, Prevotella, and Porphyromonas spp. Causes: manicuring, nail biting, thumb sucking, picking at a hang nail, and in toes, this occurs in association with ingrown toenails. Clinical presentation: a painful erythema and swelling of the proximal and lateral nail folds, usually in 2 to 5 days following a minor local trauma. Superficial abscess is frequently present. Paronychia usually involves one finger. Toenail paronychia is most often associated with ingrown toenails. Complications: the infection may spread to the underlying nail bed or to the pulp space, also known as a felon. Felon requires prompt surgical treatment with incision and drainage to prevent the development of osteomyelitis, permanent nail deformities, and ischemic necrosis of the fingertip. Late complications of acute paronychia include dystrophic changes of the nail plate, onychomycosis, detachment of the nail plate, and permanent nail dystrophy. Treatment: paronychia without abscess. Warm water or antiseptic soaks. This includes chlorhexidine, povidone iodine multiple times per day. Then apply a triple antibiotic ointment or mupirocin after each warm soak. Warm soaks should last 10 to 15 minutes each. Oral antibiotics may need for severe cases that do not respond to topical treatment alone. This includes dicloxacillin or cephalexin, which is the first line, trimethoprim or sulfamethoxazole, clindamycin, or doxycycline for MRSA. Acute paronychia with abscess formation is generally treated with incision and drainage. A pus culture can be obtained for all drained paronychia. Prevention: careful local skincare is advisable for the prevention of chronic paronychia. Patients should keep their hands and feet as dry as possible and not soak them in soapy water for prolonged periods of time without adequate protection. Nails should be cut carefully, and nail trauma or injury should be avoided.